welcome to Medical Dialogues, daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top news from the health world. NEET PG 2021 results declared. Common counselling for MD, MS, DNB and PG Diploma courses, says NMB. New MTP Act comes into force, upper limit extended to 24 weeks in special cases. The National Board of Examination has released the results scores of the NEET PG 2021 obtained by the candidates. Issuing a notification with the release of results, the NAT Board notified about the cut-off scores for the admission to PG medical courses this year. The notice added NEET PG 2021 rank and the merit position for all India 50% quota seats shall be declared separately. Final merit list category-wise for state quota seats shall be generated by the states as per the eligibility criteria, applicable regulations and reservation policy. In the related news, the NB has announced common counselling for DNB course along with MD, MS Diploma courses for the academic year 2021. Information to this effect was recently announced by the NB in a notice. Early NB used to conduct counselling to DNB courses on the basis of DNB CAT results. Now MCC along with the NEET PG counselling to MD, MS and PG Diploma counselling will conduct the procedure for DNB admissions as well. All the NEET eligible candidates aspiring for admission to PG courses, MD, MS Diploma, PG, DNB are hereby informed that the PG 2021 counselling will be held as per schedule, which will be uploaded on the Medical Counselling Committee website. As per the notification, the MCC Directorate Journal of Health Services will conduct the NEET PG Counselling 2021 for the following. 50% of all India quota seats of all states. This year, Jammu and Kashmir is likely to participate in all India quota counselling subject to confirmation from competent state authorities. 100% seats of central universities, Aligarh Muslim University, Banaras Hindu University, University of Delhi, central institutes as per eligibility conditions mentioned in information bulletin duly uploaded on MCC website. 100% seats of deemed universities. All PG seats of colleges under Employees State Insurance Corporation. All PG seats of Armed Forces Medical Service Institutions. Central Institutes, VMMC and Safdarjung Hospital and ABVIMS and RML Hospital. From this academic year, that is 2021 to 2022, MCC will be conducting counselling for PG DNB seats of institution across India affiliated to NBEMS as per the directions of the Honourable Supreme Court of India. For participation in NEET PG Counselling 2021, the candidates are required to go for registration at the official website of the Medical Counselling Committee. Kindly note that non-refundable registration fees and refundable security deposits have to be paid by the candidates at the time of the registration as per their category. The refundable security deposit of candidates who do not join the seats allotted to them in round 2 and in further rounds of counselling will be forfeited. Reservation of seats under SC, ST, OBC, EWS and PWD category will be as per Gazette notifications, Supreme Court directions. The Medical Termination of Pregnancy Act 2021 has come into force from last Friday, that is September 24, 2021, and has extended the time limit for abortion to 24 weeks from the existing 20 weeks in special cases. The amendment modifies Section 3 of the Medical Termination of Pregnancy Act, extending the upper limit of time for MTP to 24 weeks for certain categories of women, including the rape victims. The purpose of MTP Amendment Bill 2021 was to expand access of women to safe and legal abortion services on therapeutic, eugenic, humanitarian or social grounds. The amendments include a substitution of certain subsections, insertion of certain new clauses under some sections in the existing MTP Act 1971 with a view to increase the upper gestation limit for termination of pregnancy under certain conditions and to strengthen access to comprehensive abortion care under strict conditions. The Union Health Ministry notified that the Medical Termination of Pregnancy Amendment Act 2021 would come into force from September 24. Section 3 of the Act clarifies when the pregnancies may be terminated by registered medical practitioners. However, the extension of time for medical termination of pregnancy is not applicable for all the women and it only applies to rape survivors, minors and pregnancies with fetal abnormalities. For more information, check the link below in the description box. That's all from the health world today. Let's look at the medical news.
Hello to all. I am Dr. Nandita and here is what we have for you from the medical field. Myopia prevalence rises among homeschooling children during the COVID-19 pandemic. Novel drug Dorzagliatin may help diabetes patients achieve remission. potential sex differences in outcomes observed when undergoing the transcatheter left atrial appendage occlusion. Diabetic ketoacidosis admissions in the COVID-19 pandemic vary by the type of diabetes. Smoking may be associated with alopecia areata, reveals a recent study. The COVID-19 pandemic has had a significant impact on childhood mental health, and with the closure of schools, online classes have put a toll on the kids. The screen time specifically has increased a lot. This has led to an increased prevalence of myopia. The study that has been published in the BMG Pediatrics has revealed that during the 4 months of home isolation preceding the 2020 assessment, children in grades 1 and 2 were taught online for 1 hour per day, whereas those in grades 3 to 6 were taught for approximately 2.5 hours per day. Outdoor activity was strictly restricted, often to even none. The study found out that there was a clinically and statistically significant shift towards myopia for the ages 6, 7 and 8 years when compared with the previous 5 years. There was an increased prevalence of myopia in the year 2020 as compared to previous years, and this change was remarkable among 6 to 8 years children. Hence, the authors concluded that following lockdown and homeschooling, children showed both greater amounts of myopia and had a higher prevalence of the disease than in the recent 5 years. Diabetes remission is quite a new idea. A lot of research is needed before we fully understand the concept. We don't have enough evidence that remission is permanent, but a recent research presented at the 6th China Biomed Innovation and Investment Conference revealed that an investigational drug by the name Dorzagliatin may make progress in diabetes remission. The drug is a glucokinase activator designed to control the progressive degenerative nature of diabetes by restoring the glucose homeostasis in patients with type 2 diabetes. The study was conducted in a total of 69 patients in 5 clinical sites in China. The researchers comprehensively evaluated their subjects and the HbA1c control goals. The results showed that the subjects had a 52-week glucose remission rate of 65.2%. The study again showed positive results where patients who reached the normal blood glucose level after Dorzagliatin treatment were able to maintain their blood glucose level and beta cell function even after discontinuation of the medication. This has strengthened confidence of researchers in the cure for type 2 diabetes. Left atrial appendage occlusion devices, commonly abbreviated as LAAOs, are well known to reduce the risk for thromboembolism from the LLA in patients with non-valvular atrial fibrillation, specifically those who are not good candidates for long-term anticoagulation. However, the FDA has recently informed the healthcare providers of potential differences in procedural outcomes between men and women undergoing this LAA procedure. The real-world study evaluated approximately 49,000 patients. The results showed a significantly higher rate of adverse procedural events in women than in men, including any adverse events, any major adverse effects, and hospital stay longer than 1 day. Procedure-associated death was 0.3% in women and 0.1% in men. Hence, it was suggested that women might be at greater risk than men for procedural outcomes, including major adverse effects after device implant. The prompt recognition of new-onset diabetes and the features of those at risk of diabetic ketoacidosis in patients with type 2 diabetes are key to mitigating the excess DKA admissions, particularly the ones observed during the COVID-19 pandemic. A Lancet study published recently has highlighted that emergency admissions for diabetic ketoacidosis rose during the COVID-19 pandemic among people with type 2 diabetes and those without a prior diabetes diagnosis, but at the same time dropped among those with type 1 diabetes. The data was obtained from a national database. DKA admissions were compared when the first wave, the post-first wave and the second wave and the equivalent pre-pandemic periods in 2017 to 2020. It was observed that there was an overall rise in all hospital admissions with DKA during all pandemic wave periods compared with pre-pandemic periods. But while there was a significant rise in DKA admissions for people with type 2 diabetes and those with new-onset diabetes, there was a concurrent significant reduction in people with type 1 diabetes presenting with diabetic ketoacidosis. These trends were similar in both waves despite the minimal availability of SARS-CoV-2 testing in the first wave compared with the universal availability during the second. Smoking kills. A quote written on cigarette packs. Everybody knows it. Various studies have proven that smoking has harmful effects. Another one recently published is that smoking may be associated with alopecia areata. Alopecia areata is an autoimmune disorder characterized by non-scarring hair loss. The etiology behind it is not fully understood. However, immune system is known to play an important part in its pathogenesis. Cigarette smoking is shown to decrease the levels of anti-inflammatory cytokines and increase the level of pro-inflammatory cytokines. The study included a large sample size with over 1 lakh female patients with alopecia and more than 2 lakh without the condition. The study showed a statistically significant higher prevalence of smokers among patients with alopecia areata. The authors did conclude that further well-designed studies are warranted to elucidate the effect of smoking and to find additional risk factors for the condition which is termed as alopecia areata. That's it for now. From our end, we'll see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.